Well, United Nations agencies say collective action is a solution to fighting growing threats to public health security linked to climate change and other elements. The new call for joint action to avert a public health crisis in the future was made by 4 UN agencies, including UNEP and the FAO. Charged with implementing a One Health strategy to secure a safer, healthier and greener future for humanity. The 4 agencies stressed that better multi-sectoral coordination would be key to tackling climate challenges, ecosystem depletion and the spread of superbugs. The UN agencies are also calling for the creation of a fund to support pandemic prevention, preparedness and response. They're currently assisting national governments to implement the One Health strategy. Well, earlier we spoke with Dr. Francesco Branca, Director at the Department of Nutrition for Health and Development at the WHO in Geneva. He began by explaining who the target of the joint action was. Here are some highlights from his discussion with us.
The targets are first and foremost governments, because governments may decide to adjust their development policies in a way that is really protecting people's and planetary health. If you think, for example, of issues around land use, deforestation, which is responsible for an impact on the planet, but also eventually is going to push the wildlife closer to the humans, and that is, of course, at the risk of the transmission of the disease, or also the way food is produced and distributed. Intensive animal farming that require the use of antimicrobials, or that give more easily the rise to infectious diseases that can become pandemics, such as the avian flu. But that means that governments need to establish policies, regulation, guide investments such that, for example, we improve farm biosecurity. We have food markets that do not allow the transmission of diseases from animals to humans. But it also means that the health workforce, the doctors and the veterinaries have to work together on the prevention of diseases. It also means that we need to have adequate system to monitor the emergence of these infectious diseases in animals before they get into humans. It means that there must be a much greater exchange of data to understand, for example, what is the impact of making certain choices on the environment and allowing the exploitation of the land to extract important minerals. There must be a good assessment of the trade-off between this development choices, often guided by economic drivers, and then the impact on the planet and the health.